I am so proud to announce that we have, at the time making this video, opened 3 physical locations for tinnitus treatment. And I'm happy to announce that our newest location is in Charlotte, North Carolina. To date, we have San Francisco, Miami, and Charlotte. And I wanted to share in this video just a few short notes that I made on the back of my receipt from getting a burrito here during my lunch break. I just made some quick notes that I wanted to share with you guys about why we're doing this, what it means for you, the new provider in Charlotte who trained with Dr. Jastreboff in tinnitus retraining therapy, what the differences are between these 3 clinics, and what studying with Dr. Jastreboff and that effective tinnitus treatment method combined with newer treatments available today, what that means moving forward. About a year into my journey, I realized that what we're doing here was, at a simple level, helping people. Unfortunately, most doctors completely drop the ball for tinnitus with their patients. Doctors are not well educated, they don't provide a treatment, and they tell patients very damaging things like, hey, there's no cure, you just have to ignore it, or there's nothing I can do for you, sorry. Or, oh, tinnitus? Yeah, I have it too, just try to forget about it. It will go away one day. But the reality is that many people with this condition are really struggling. To date, we've seen over 2,000 patients via telehealth, but we've gotten feedback and it became clear to us that some patients prefer an in-person tinnitus treatment experience and that there's some advantages to doing the treatment in person. Therefore, in July 2025, we've now opened 3 clinics here, 1 on the West Coast and 2 on the East Coast. And the unique thing about Charlotte, North Carolina, is that it's an acquisition. So different from San Francisco, where we opened a clinic inside of an existing ear, nose, and throat medical clinic. Different from Miami and South Florida, where we opened up a private practice from scratch. We got the space ourselves and are outfitting it. This space in Charlotte, North Carolina, we are acquiring the clinic. So that means we get to work with the amazing audiologist, Dr. Melissa Karp and her team. Dr. Melissa is a specialist in tinnitus. She studied with Dr. Jastreboff for the tinnitus retraining therapy course, as did I. You can see a picture on the screen right now with Dr. Jastreboff and myself. I visited him in his summer home, and yeah, I'm wearing a short sleeve shirt, and we're sharing some laughs there. But for those who don't know, the Dr. Jastreboff lineage is very important here, because if you follow all the best tinnitus specialists and who they train from, almost all of it goes back to Dr. Jastreboff, where in the 1990s, he released this protocol or this method called tinnitus retraining therapy. And he explained that his theory is that there's a model of how tinnitus and the brain works, and he called it the neurophysiological model of tinnitus. Neuro means neurological. Physiology means the physical structures or the parts of our organs and muscles and bones, etc. How the nerve interacts with the physical systems, how the brain interacts with the ear. And I've done podcasts with hundreds of experts, researchers, the best doctors, the best clinicians. So much of the knowledge comes back to this neurophysiological model of tinnitus and tinnitus retraining therapy. So Dr. Melissa Karp offers the best tinnitus treatments that are available, and all of them at this physical clinic. Some things we don't currently do via telehealth that she's able to do in person. So I'm so happy and excited to partner with Dr. Melissa. And let me tell you what else you can expect in our different locations. The Charlotte location, that's going to serve North Carolina and parts of South Carolina as well. We have multiple audiologists who are working there with Dr. Melissa, and they provide the diagnosis of tinnitus and hearing loss. They also provide treatment for tinnitus and hearing loss. In the Miami location, which is in the specific town called Weston, just outside of Miami in South Florida, that's accessible from most of South Florida. We have Dr. Tricia there, who is formerly at University of Miami Health, leading the tinnitus treatment team. And she's able to diagnose and treat tinnitus and hearing loss as well. In San Francisco, we have Dr. Priscilla, who formerly worked at UCSF Medical Center on the tinnitus team, just like I did. And Dr. Priscilla will be offering diagnosis and treatment of tinnitus in collaboration with some of the top ENT doctors in Northern California who are working in the same office as her. So we can see here that there are these 3 different models for how we're reaching more patients with Treble Health. But guys, one thing that's become so clear to me is that there's 2 things that are simultaneously true And I want you to hear me out on this. One of them is that so many patients are not getting helped right now. There's more effective strategies in place that just most patients are not even introduced to. They're not educated on, and they're not offered to work with them for a comprehensive tinnitus treatment, following the evidence, following the science, with a skilled provider who can really help them using the best tools and techniques. That's so much of a problem that that's what we're focusing on. Now, simultaneously, this is a condition where we want more effective treatments. We want different treatments available as well. Something that is particularly interesting, I think, in this domain would be the Dr. Susan Shore research, where that's just an example of a potential treatment that has optimism and hope behind it. It's not ready yet, but it was funded over the years. It was researched. And now I believe they're in the process of trying to get it FDA approved to be available. There's other bimodal stimulation devices. There's other hearing aids for tinnitus. There's tinnitus retraining therapy. There's cognitive behavioral therapy, right? But I just wanted to address that there's two things simultaneously. One is help more patients right now with the tools that are available to help them. Second is how can we do better as an audiology community, as the medical community? How can we find treatments that work potentially even better than the current existing ones? How can we perhaps find a cure through biotech research or through restoring the cells in the inner ear, those small little cells that cause hearing loss, or something else, So both of those things are simultaneously true. We are not tackling the research of finding a cure for tinnitus. We donate to researchers here and there, but it's not our mission. Our mission is to provide the top level care for tinnitus patients and use the existing tools we have to help them. So I just wanted to address that because I think it's really important. That's why we're opening physical clinics. That's why we're still growing our telehealth practice. Both of those things will be continuing to go. It's all under the Treble Health name. We know that a lot of you have been looking for help for tinnitus. So offering the telehealth Zoom option that works very well, where we've sent the medical devices to the patient's home, and the specialized tinnitus provider, the audiologist who I've hired on our team, we do the treatment remotely from home. You'd be surprised, that works extremely well. And we've seen over 2,000 patients through that model. But now in 2025 and beyond, we are opening physical locations. And I'm really excited about it. This is like such an amazing vision. There's unfortunately so many cities across the US where there's not great tinnitus specialists. So now we have Charlotte, Miami, San Francisco, and those greater areas where patients can get help. This is a big deal. And for me personally, this means a lot, because at some point in the journey here, this became less about me wanting to do something that could benefit me. And it became much more about, okay, my original goals with this were very humble. I wanted to have some freedom and be my own boss, basically just work by myself. But then it became clear, whoa, there's a huge need for specialized tinnitus treatment. And there's an opportunity to reach way more patients, because our YouTube channel here, people like you, thank you so much, are watching and liking and maybe sharing some videos with some friends or family. Or, if someone talks about ear issues, you say, hey, you should check out Treble Health. They have some helpful videos. That's exactly why we got to where we are today, from your help and from YouTube and from doctor referrals. So we've been able to reach a lot of patients, and it became clear to me that our mission is to help the many people who are not getting high-level tinnitus care. So with that frame of reference, then okay, how do we do it? Like I said, our skill set is not in the research and the hard science of trying to solve tinnitus and drugs and clinical trials. That's not our background. We're clinicians. We work hands-on with patients, and that's what we were trained in. So my brother and I are running Treble Health, and we have an amazing team of audiologists who are stepping up as leaders to provide excellent care and be very compassionate and empathetic and patient as we go through the tinnitus treatment process, which we know takes time. I wanted to highlight that this lineage of being trained by Dr. Jastreboff, and then having Dr. Melissa Karp in Charlotte, also being trained by Dr. Jastreboff, as well as other members of our Treble Health team. And of course, we lift each other up based on our knowledge from working with him. This is an absolute honor and it's a privilege. So, working in this lineage, it's really important to do things right. It's important to be evidence-based and science-backed. And guys, I'm not perfect. I've made mistakes. There's been certain videos that I've put out that I've taken down. There's been videos that I've put out that I've had to change the title because the language was just off. It was, insensitive. So, I've sent certain emails that people have responded and said, hey, you shouldn't be sending that email. That's inappropriate. Like, I've made mistakes, but I'm human, but I've been really trying my best to lead our team at Treble Health into a place where we can reach its potential. It's sort of like when you have a child and you send it to the best school. You say, I want to give this child the best. I want to give my child the best education. I want to give them the most opportunities in life. Well, I'm seeing Treble Health as similar to that, where I want to provide opportunity for this Treble Health, mission to get some legs under it, to get some wings and fly, or get some legs and, walk a long distance, because so many people need help for tinnitus. And the more and more I do this, the more people I speak with, the more success stories we see, the more graduates who finish our program, the more feedback I get, the more podcast guests I speak with. It's propelling us even further. It shows us tinnitus treatment exists right now. There is help you can get. And that's why we have launched 3 clinics and more coming soon. So if you guys want to learn more about what we're doing here, you can go to our website, treblehealth.com, to look at our 3 locations plus telehealth, or you can comment below of which city you'd like to see a new Treble Health location in and why. I'm Dr. Ben Thompson, founder of Treble Health. We'll put those links below if you want to connect with us. And thanks for hearing me. I'll leave with a last word, which is, guys, take a deep breath right now. Just take one small action that can put your mind in a better place, connect with your family and your loved ones, and just realize, we're lucky to be alive. What a gift. Thank you so much, and hope we get a chance to help you. But if not, you've already helped us. So thanks for watching this video.